Shalom, welcome to Rabbi Rock. This is Rabbi Praver, Shaul Praver, from Congregation Adath Israel in Newtown, Connecticut. It's nice to have you here again. And very recently we had a very fascinating guest, Dr. Michael Taweh, who spoke about Kevin's Community Center providing health care to all uninsured indigent people here, residents of Newtown. Everybody will have health care, health coverage in this town of Newtown because of the work, the very important work that Dr. Michael Taweh has done together with all of the doctors and people that have supported him on his team, have shared this great vision of Kevin's Community Center. I spoke recently about the idea of when will we know that the Mashiach has come. For Jewish people, we understand it coming for the first time. For Christians, your belief is coming for the second time. Whatever our theology is, one thing we have in common as people of spirituality is the idea of it is possible for this world to be such that people are healthy, people are not dying of AIDS, people are not dying of cancer, people are living out their normal life expectancy in a qualitative manner, no starvation. All of these kinds of ideas are the messianic, the great utopian vision of the Torah. And we are not waiting for God to do this. We are seizing the spirit of redemption which is available to us. And that's why I invited Dr. Michael Taweh, who is doing God's work in founding, in memory of his beloved son, Kevin, the Kevin's Community Center. And I really very, very taken with his work, and I feel that it's not only the answer to Newtown, but it's very well could be the answer to the crisis of medical care in this country, throughout the country, on a national level and perhaps even internationally. Now, what this man has done has solved the problems in this town that could be done in other towns. That could be done in other states. We could be getting the cooperation more of from the insurance companies, from the legislators, from the federal government, from the state government. We could make this into a bigger thing. This is really a great opportunity to hear a great architect of medical care. We've tried many different things. We've tried the path of reform, and now we have the path of people in towns taking the bull by the horns and solving their problems, because we can do it. We have the power to do it. Doctors can cooperate with the local version of a Dr. Michael Taweh in other towns, other states. This can be duplicated. It's one thing for to pay your taxes and then have the government take care of all of these different social needs. But the spirit of the Torah is that you give yourself the tithe. You give from your own field in the ancient days, from your own flock. And there's a certain value in the hands-on approach of being a person in a town taking care of these problems. We have 93 million uninsured Americans. 93 million. People that are suffering. And many of those people will die, or some of those people will die, because they don't have the simple medical intervention. It might be simple, it might be more complex. But whatever it is, it's because these fatalities occur because they don't have the proper medical care. So if we want to be a spiritual community, spiritual people, we have to be concerned about people that are living on the edge like that don't have a doctor to go to and might not go to a hospital if something hurts. And if they only went, they would be alive, or they would be more healthy. So once again, because of the importance of this subject, I've invited Dr. Michael Taweh again to talk about Kevin's Community Center, not only in the context of Newtown, but in a broader universal sense, as it comes from his own spirituality as well. So we're indeed very fortunate to have Dr. Michael Taweh again here with us. So stay with us. We'll be right back. Shalom. Welcome again. We're really privileged to have Dr. Michael Taweh here with us again, and I felt that this is an important enough subject matter, really a subject of life or death at some cases, where people don't have health insurance and need medical care, and that's why I've invited once again Dr. Michael Taweh to be with us, and I welcome you. It's great to have you.
Thank you very much for having me again.
I said a little bit in the introduction that I don't believe this is just the answer for Newtown. And before we go into that, I want to point out or ask you, you didn't name, as the founder, the name of this as Kevin's Community Clinic. You named it Kevin's Community Center. And I'd like you to tell us a little bit about that.
Well, when we first decided to have the clinic, we actually started working for a community center, one aspect of which would be the clinic, and that's where we're at. But the other aspect is obviously to have a along the freestanding clinic and an interdenominational chapel and a lending library where we can actually provide services in addition to just medical services, other non-medical services, making it more of a holistic approach to approaching not only medical problems but care and compassion, integrating medicine into it as only one aspect of this bigger picture.
Okay, the spirit-body connection.
Yes.
And tell us about that, because that's a whole a very fascinating subject as far as how a person of faith could have less anxiety because they live for the day. You know, the Lord's Prayer, you know, give us our bread for this day. Not to be over anxious, to have some faith and trust, as you know, important parts of maintaining health. So obviously you thought of this, so let's hear.
Well, it makes it more a more effective endeavor to not only treat the medical aspect but also the psychological and the spiritual aspect. And we know that medicine has its limitations and has a lot of limitations, and integrating the sometimes more important and essential elements of spirituality and psychology into it obviously makes it more meaningful, and hopefully maybe even unique, a model that can be imitated in the future.
Okay, so we have a health, Kevin's Community Center has a health clinic, and you have a vision of having an interdenominational place of worship. Would there be services? How do you envision it?
We don't have definitive plans, and I think when this is realized, the bigger the center itself, when it becomes a reality, it would be left primarily up to the religious leaders in the community on how this can best serve the community and the patients.
Okay.